So just bear with me. There we go. Now we're live. So hello, friends. Today really I would love to talk about low thyroid function and what to test for, because I cannot tell you how many people are telling us on a regular basis, I've had my thyroid tested and it looks perfectly fine. My doctor's saying that nothing is wrong with my thyroid. And for many people, that is very far from truth. So one of the things you're going to discover today is what are the symptoms to really look out for that you really should not be ignoring if you're experiencing those. So thank you for the happy birthday wishes. Yes, I've just turned 50, and thank goodness I've got my thyroid under some pretty good control. Because when you don't, you feel like you were 70. When I was first diagnosed, I was 35, and I felt like I was probably 65. I was so exhausted. So this is part of the reason why this topic is really close to me, because I was very lucky to get diagnosed really quickly, really well. And I knew what to look for. And this was a complete coincidence and just pure luck. But not everybody is so lucky. And so I really want to talk about this today. Plus also remember that, it's not uncommon to have low thyroid function combined with other hormonal imbalances. So very often you have something like women in menopause, so low estrogen levels, low progesterone, coupled with Hashimoto's disease, which causes low thyroid function. It could be that you have estrogen dominance and low thyroid function, or Hashimoto's. It could be that you're experiencing PCOS and you've got low thyroid function, right? And so it's very seldom that we only have one hormonal imbalance and not more. In fact, when I was going through my crisis with hormones, I was experiencing I was diagnosed with Hashimoto's disease in 2008. And then I had a total HPA axis dysregulation, which a lot of people call, adrenal fatigue. And then most definitely 100% I had estrogen dominance, all of them happening at the same time. So I want to prevent you from, I want you to have the education really about what to test for, because that's really the most important thing, which is what functional medicine completely misses out on. So let's start off with saying that, let's maybe start off with what are the symptoms of low thyroid function to start off with. And then we can explore what are the tests to order, how to order them, where can you order them, and why do I say to order them. So the first thing, symptoms, one of the first symptoms that you might start observing in low thyroid function, and this is especially very common for women who've just delivered, that had just had a baby. So postpartum hypothyroidism is very common. It happens also a lot for women who enter perimenopause and menopause. But also if you had gone through some very stressful events in your life, a lot of the time we find that women are experiencing hypothyroidism soon after that. And that's got a lot to do with stress. And we can talk about that later, how it impacts the thyroid. So what are the symptoms? The first thing is that you starting to feel like a real sense of fatigue. And so, and the fatigue is not like, oh, I'm tired. I'm kind of like, I feel like I want to go to bed. I'm a little bit sleepy. No. Thyroid fatigue, it feels like you could be lying on a sofa the entire day. It feels like something has just sucked the life out of you. So has any one of you experienced that kind of fatigue? That's the first thing. And there's no real good reason why you should be feeling fatigue. Here's the thing. Observe yourself. And if you're finding yourself going, maybe it's a change of seasons. Maybe it's because, my husband is not working anymore and he's like at home a lot more. I've got a new boss, or, like finding those external excuses. To just be mindful of that, because it could be that it's nothing to do with the weather, with your husband, your boss. It could be that it's just you dealing with hypothyroidism. Okay. Second thing is, suddenly feeling cold a lot of the time. And what I mean by cold is like you are the person who's got a jumper on the beach while everybody else is in a bikini. You always have cold hands, like you put your hand, or you put a hand on your friend, and they'll be like, oh, your hands are really cold, or you go and get a massage and the massage therapist starts working on you, like, ooh, really cold hands, right? So coldness of low temperature in extremities, but also on feet. Like if you're the person who likes to sleep with your socks on, that's one of those things. And it feels like it's cold, like in the inside of the body, right, as well. The other, next very much a symptom that could be connected to your thyroid function is suddenly putting on weight. And what I mean by that is like, you've always had a certain weight, right? And then now due to, and then suddenly out of no good reason, meaning that your diet hasn't changed drastically, your life circumstances have not changed drastically, your exercise routine has not changed all that much, you've suddenly put on, over the course of the past 6 months, you've put on 20 pounds. And it just really feels like it came out of nowhere, right? That's a huge red flag. And the frustrating thing is when you go and see a doctor, a conventional trained doctor, they will say, well, just exercise more and eat less, right? And the truth is that the matter is that you start doing that, it can get even worse, or you can't exercise more because you're just too tired, right? So let's see, what else? The other common symptom of hypothyroidism is when your hair starts falling out, right? But it's not just the hair. It's your hair starts falling out. It's also your eyebrows, like especially the third of your eyebrows. You might also find yourself that your eyelashes are suddenly, you're finding eyelashes on a regular basis on your cheeks. But it also could be that your hair, as well as your nails actually, are beginning to feel a lot more brittle. So, like you used to have this beautiful, shiny, thick hair, and now suddenly they are lifeless. And when you shower, you see a whole bunch of hair down in the drain, right? And you go like, well, hold on a second, nothing has really changed, and I have been taking biotin, and I've been trying all sorts of hair solutions. That's why a lot of times when people ask us, what supplement do you recommend for hair loss? I find it very difficult to answer that question because it all depends what causes your hair loss. My hair loss was caused by hypothyroidism and then later on by estrogen dominance. So if you don't address the root cause, then it's hard to talk about hair. So hair and skin, hair and nails, definitely. The other thing is with hypothyroidism is that you might be experiencing just dryness on the skin, and especially the dryness can come from your sheens, right? So on your legs, your lower part of your leg where the sheens are, you have like this constant dryness. And if you just like massage your leg up and down, like you see the white skin just like peeling off, right? It's almost like a little sand that's coming off your legs. Very symptomatic of hypothyroidism. Another thing that comes up a lot with people with hypothyroidism, and I'm using that as a blanket statement for both hypothyroidism and Hashimoto's disease, which I'll explain in just a second. And that is to having different mental functions. So a couple of things. First of all is brain fog. So I've met a lot of women in the past who had to give up their jobs. They were professionally not as prolific and capable because of brain fog, right? And I mean, how many of you can do your job well, when your brain function isn't not very good? I think one of the scariest clients I've ever had was an air traffic controller in New York City at LaGuardia Airport who had severe brain fog problems while she was an air traffic controller. So that was like, whoa. But not just brain fog, but it also can be depression. It can be anxiety. For example, I never had a depression when dealing with Hashimoto's, but I had a severe, a couple of times the cases of anxiety, which I had never previously experienced in my life. And I literally wanted to crawl out of my skin. And it felt really, really horrible. There are some other peripheral symptoms that could be because of Hashimoto's or low thyroid function, but it doesn't have to be. Such as, for example, having a lot of constipation, right? So constipation, think of it this way. So the thyroid is like a speed pedal, right? In your vehicle, like when you press on your accelerator, right? That's what the thyroid is. It just gives you the sense of energy. It gives you the ability to digest food properly, right? Eliminate your food properly. And when everything slows down because the pedal isn't working so well, then what happens is then you might be experiencing also slow bowel movement, not just fatigue and overall slowness. So, I would say I probably covered most of the symptoms when it comes to hypothyroidism. And so here's the thing, whenever you feel like you have been having these symptoms and you went to get your thyroid checked and they told you your thyroid looks perfectly fine, no problem at all, right? I say run the other way and get your test done properly. And when I say properly, it basically means that you've got to have a complete thyroid panel. And we're going to be talking about the 5 markers that you need to ask for and get tested in order to get a complete thyroid panel. I'm doing this educational video today because we're also doing a webinar on Thursday with Dr. Ellen Hopkins, and we're going to be talking about what to order for overall hormone testing. Thyroid panel is going to be one of them. And from that, after the webinar, we're going to be running like $20 per panel discounts, so you guys can then go and claim these discounts and order the tests yourself. So if you don't have a good doctor who would collaborate with you and order the tests for you, then come and join us at the webinar on this Thursday, and then watch and write down all the markers that you need to get tested. If you have a doctor who can support you, then listen to this video, and I'm going to tell you all the markers that are what's considered in a functional medicine the correct ones. So let me just start off with the labs that every doctor most likely will order for you if you suspect you have a thyroid function. The first one is they will order a TSH, right? Thyroid stimulating hormone, very standard test to order. The problem with TSH is that a lot of people, there's 2 problems with TSH in the current context of allopathic medicine. The first one is that a lot of people who have actually there are 3 problems. The first one is that a lot of people who have thyroid conditions actually have a pretty normal TSH for whatever reason. My TSH, in fact, was 1.5, which is perfectly normal. Yet I had a raging case of Hashimoto's disease. Had I not tested for one of the markers I'm going to tell you about later, which is the antibodies, I would have never discovered I had Hashimoto's, and I would have gone on probably for months and years struggling with my symptoms. So that's what I want to prevent for you from happening. So the other problem with TSH alone is that the range you're looking at has to be, you're going to look at it from the prism of a functional medicine and not allopathic medicine. So if you pull out your test labs report right now and you look at your TSH, the healthy range that TSH should be in is a 0.5 to 5.0. Very broad range if you think about it, from 0.5 to 5.0. The problem is a lot of people are very sick when they are on those extremities. So functional medicine says no. A healthy thyroid function, it should be between 1 and 2. Your TSH should be between 1 and 2. So remember the range. The range is really, really important to look for. The third problem that I had with TSH alone, testing only that, is that you don't know whether you have Hashimoto's disease or not. And that's important to understand, because I will talk about antibodies in a second, because majority of low thyroid functions are caused by Hashimoto's disease. So you really are not dealing with a low thyroid function. It's secondary. The primary cause of your problem, your how you're feeling, is an autoimmune disease. And what you need to treat is the autoimmune component of your disease and not the thyroid alone, okay? So TSH is definitely a marker I recommend, but that should not be the only marker. It should not be the marker that has led your doctor to say you have no thyroid problem. Some physicians will test for something what's called the total T4, okay? Now, the problem with total T4 is multiple. Number one, it shows you total, as the word implies, is total. Total means it's both unbound and bound. When the T4 hormone is bound up to molecules to specific protein in the blood, it's not available for conversion to the next hormone, which I'll tell you about in a second. And so it makes it kind of useless. So what you really want to know is how much of free T4 you have, the unbound form of T4 hormone, to see how much is that available for your body to then convert to the next hormone that I'm going to be talking about, which is T3. Now, mind you, T4 is what your hormone, what your thyroid gland first produces. However, it is not the working horse of your body. T4 is kind of only a very small percentage of it is actually utilized. It needs to be converted to T3 hormone, right, for it to be actually useful for you to understand how your body functions and if your body can function properly. So T3 hormone is very little of it is produced in the thyroid. It actually gets converted in the gut and in your liver then to T3. And this is the tragedy, if you will, of Western medicine, is that the T3 hormone is hardly ever tested. Yet it is your working horse. That is the hormone that gets into your cells. That's where your hair, your skin, your brain, your breasts, your ovaries, I mean, your entire body requires T3. That's what gives you energy, beautiful hair, ability to lose weight, convert fat to energy. And, and that's your working horse, right? Why is it not tested? It's a longer conversation. There's a lot of dogma and a lot of legacy that's just left behind from very outdated tests that has just never been corrected. Even though the American Thyroid Association does recommend doing it, most endocrinologists do not. So note here that when you're testing for T3, similarly to T4, you want to have the free version of that, right? The unbound T3, that's your working horse. That's what you want to be testing. So in case you're coming in late, we're talking about testing. TSH, yes, important, but kind of I see it as auxiliary. The next one is free T4 hormone. The next one is free T3. And that gives you the understanding of your thyroid hormone or your thyroid function, right? And the conversion up to the T3 hormone. Okay, cool. So that's about the thyroid hormones. Now, another two markers that are super important for you to understand and to really insist on testing, and that is the Hashimoto's antibodies. There's two types of antibodies. The anti-TPO, so TPO is oftentimes presented on the lab work as TPO antibodies, thyroid peroxidase antibodies. And they're going to be showing you the activity of the immune system in attacking your thyroid gland. And that's super important to understand, because if your TPO antibodies are super high, right, are elevated, it's considered anything, depending on the lab, but it's between 30, you have a case of Hashimoto's. If it's more than 100, it's considered a pretty highly inflammatory version of Hashimoto's disease. Then what happens is then you need to treat the autoimmune component of your disease and not the thyroid alone, okay? Because if you're just treating the thyroid alone, meaning, for example, you're taking supplements for low thyroid function, right? It's got tyrosine in it, iodine in it, bacopa, whatever herbs and stuff like that, right? You see, it's a little bit like you are basically, imagine like you have a house and there's a leak in the roof. And so taking this low thyroid supplement is like you're painting, taking out a paint and painting where the leak is in the roof, rather than getting a roofer to come and fix your roof, right? And that's what dealing with autoimmunity is about. You're going to get on the roof and stop the leak on the roof and not be painting over it, right? Does that make sense? I hope this analogy makes sense to you. And dealing with autoimmunity is far more complex, right? Because now you're dealing with parasites, changing your diet, correcting a lot of different nutritional deficiencies, and so on and so forth. So I will talk about LDN in just a second. Somebody's asking about LDN. So that is so that's anti-TPO. You've got to insist on doing that. I've had doctors in the past who said to me, I'm not going to test your TPOs because they vary every time. Every hour, your TPOs are different, right? Well, the truth of the matter is the reason why they don't like to test for it is because there isn't one pill that can give you to lower your TPO antibodies. And even even if your antibodies fluctuate, they're not going to fluctuate between 30 and 300. Let me just say that. If they fluctuate, it's probably going to be fluctuating between 280 and 320, 280 and 350, right? Depending on what you've eaten the night before, how inflamed, how stressed out you are, and so on. So, and then one more kind of antibody that's worthwhile testing that's super common. So it's called TGB, thyroglobulin antibodies, anti-TGB antibodies, or sometimes also called as anti-TG antibodies, thyroglobulin antibodies. These antibodies show two things. One is that you might have estrogen dominance, and a lot of people who have elevated TGs also are on the way to getting thyroid cancer. So be very mindful of that. A lot of people also with anti-TG already have nodules, very inflamed, very red in color nodules on their thyroid, which needs to be addressed. And then again, if you follow us for a while, you know that thyroid nodules are caused by estrogen dominance. So really you don't have to do much for your thyroid nodules. I mean, you can do some castor oil packs and stuff like that, but really addressing estrogen dominance is what's going to help you tremendously. So those are the 5 tests we talked about, right? TSH, free T4, I want to emphasize the word free T4, free T3, anti-TPO antibodies, thyroperoxidase antibodies to rule out Hashimoto's disease, and anti-TG thyroglobulin antibodies, which is also for Hashimoto's disease. My antibodies with Hashimoto's were 1600, so they're supposed to be below 300. Below 30, and I was at 1,600. That's how high my antibodies were. This is when I was living in Hashimoto's, in Shanghai, and I was diagnosed then, and it was a blessing to be diagnosed that quickly, because then it put me on a course of action of what I needed to do in order to overcome all of this. So in case you're joining us late, there is a webinar that Dr. Ellen Hopkins and I are doing on Thursday. And we're going to be talking about lab testing for thyroid, but also we're going to be talking about other testing for estrogen dominance, progesterone, estrogen metabolites, and for melatonin, and a lot of other, we're going to be talking about that testing, but also a lot of other tests that impact your overall hormonal health. So stay tuned for that. And if you are not, you don't want to attend the webinar, then make sure that you're on our mailing list. And I think we're also going to be mentioning that in the social media on like once we release the sales page, because we are passing on $20 for you guys for every panel to apply that and get it tested yourself. If your doctor is not collaborating with you, you're getting some resistance in getting those complete thyroid tests done. So be sure to insist on those. Do not skip any one of them, because every one of them is important. I'm not even talking about a lot of other tests such as vitamin D3 and your B vitamins or B6, especially in B12, or your iron levels, or your magnesium levels and your zinc levels. Like, I'm not even discussing that, because all of that can further also can impact your hormones, but I'm just talking about just to get a snapshot of what's going on with your thyroid. So remember, if you're constantly fatigued, your hair is falling out, your hair is suddenly brittle, you're dealing with depression, anxiety, you're putting on weight like you've never had before, you're feeling foggy brain, you've got depression, anxiety. So we mentioned that. You are constipated like you've never been before, right? You've got fatigue like you've never seen before. And you just don't recognize your body, right? This is really a good time to test for your thyroid. And guess what? These tests are really, really inexpensive. If you can get insurance to pay for it, do it. If you're not covered, or if your doctor is not wanting to do that, then watch the webinar on Thursday and register. And if you can't do it live, you can do a replay later. Just make sure you register first so that you can get a replay sent to you once it's over. Okay, so I will answer a couple of questions. So LDN is a medication that's used in very low doses for people with Hashimoto's disease. And I am not opposed to it at all. In fact, I know quite a number of people who have been taking LDN and had fantastic results. Here's a little, my take on this and my recommendation. Do not go to LDN as a first source of your treatment. LDN is like basically taking yet another drug to help your body dealing with the autoimmune component. However, it's gonna be hard for your body to respond 100% to it if your diet is messy, if you're not sleeping correctly, if you're not sleeping much, if you're deficient in so many different minerals, right? Anybody with Hashimoto's has to comply with an autoimmune diet, right? Which would mean getting off dairy, soy, corn, gluten, eggs temporarily, and whatever other food sensitivities one might have. Address parasites, address a lot of nutritional deficiencies, especially magnesium, D3, zinc, B vitamins, right? Those are some of the selenium is a big one in people with Hashimoto's. Those are like some of the foundational things that need to be replenished. And so I'm of the opinion that if someone has done this work and is coming out 2 years later, still not feeling optimal, still their thyroid numbers are still not looking good, then maybe it's a good time to go into LDN. That is my take on it. I just don't like replacing one medication with another when the cause of the problem is really in your gut, is really systemic. Can you put the test in a post? That will be really helpful. Yeah. So if you go to hormones, our website, hormonesbalance.com, you will see there is and they just enter lab tests, thyroid lab tests. There is a whole article we have that is just talking about lab testing. Jen, why don't we just pop a question or two? And thyroid nodules. Okay, how do I shrink them? So good questions. The thyroid nodules are the result of estrogen dominance. Estrogen dominance is what causes the growth of thyroid nodules. Estrogen dominance also is the main reason behind thyroid cancer, which is in women is the fastest growing cancer, by the way. It's benign, thank goodness. And so address estrogen dominance, and that's gonna help you. I used to have 3 nodules on my thyroid, 2 and 1, and I get it checked. I want to say once every 18 months, and get a sonogram done, and I'm totally clear. All of them have gone away. I'm an author of a book called Overcoming Estrogen Dominance. If you don't have that, I recommend getting that on Amazon. There is a whole chapter on thyroid nodules itself. I'm in menopause, though. That doesn't matter. You can have estrogen dominance being in menopause as well. A lot of people actually do. Does it raise blood pressure? Okay, I just pressed something wrong. So, Jen, do we know what raises blood pressure? I don't know what the question is about. Maybe something else? What if you had a hysterectomy? I mean, what is the question here? I mean, we're talking about thyroid testing. I'm not sure what the question is about. Let me talk about one more thing that I forgot to mention: the connection between estrogen dominance and thyroid function, low thyroid. So there is actually a connection between those two. The very common one, and the explanation behind on the biochemistry level, is that when you have estrogen dominance, you have high one type of estrogen called estradiol that tends to be the more aggressive kind of estrogen. And this is also an estrogen that you get from, skincare products, commercial skincare products that are just not very clean. And so a lot of chemicals, including parabens, are actually, they convert to synthetic estrogens, and they cause a lot of harm in the body. So anyway, so high estrogen levels, whether it's produced by your own body or whether it's coming in from the outside, things like skincare products, your diet, what they will do is the high estrogen binds up a lot of the thyroid hormone, and that happens through a protein called thyroid globulin. And so the higher estrogen you have, the more thyroid globulin you have. The thyroid globulin binds up thyroid hormone. So it's not uncommon for people who have Hashimoto's and thyroid condition to also have estrogen dominance. Which one causes which is hard to say, but I feel like, and which one should be addressed, it can be also sometimes very confusing. The not so difficult part is that when you change your diet, as an example, then a lot of things start normalizing, And the good thing is that, for example, whether you follow Dr. Isabella Wentz for her thyroid stuff, or whether you follow my work on estrogen dominance, actually, like I would say 80% of our stuff is overlapping, because we both believe in going off gluten, dairy, soy, corn, eggs, especially if they bother you, doing a full elimination diet. We both believe in rest and sleep. We both believe in a number of different supplements that need to be there to restore our health, right? So once you start fixing these things, you don't have to have one protocol for estrogen dominance and another protocol for Hashimoto's disease. You can actually see the improvement by doing the protocol in both conditions pretty quickly. If you have hyperthyroidism, then you need to do another set of antibodies, which are, I'm forgetting the name right now of these antibodies but it's basically to rule out Graves' disease. And I actually used to have Graves' disease as well, and then it became Hashimoto's disease several years later. Why? Because the autoimmune, that's a good example, right? That's because I had Graves in my late 20s, and then age 35, I was diagnosed with Hashimoto's. When I was diagnosed first with Graves' disease in my late 20s, I was put on thyroid blocker for a few months. And then after that, it's not TPO. If you just Google hypothyroidism antibodies, you should be able to find the name of that antibody. And what happened then is that doctor never addressed autoimmunity. I didn't know about it. I was put on thyroid blockers, right? So just to suppress my thyroid from overproducing the thyroid hormone. But I never addressed, because I didn't know the autoimmune component, right, of my disease. And the result of that was that 5 years later, it came back with a vengeance, and I had Hashimoto's disease. And then only then I started treating the underlying cause of all of this, which was in my case, that was, Hashimoto's disease. And in my case, that all of that came to a total remission. Today, you guys, I just want to share with you, my Hashimoto's is the latest labs that I've done. I'm down to, I still have it slightly active. I'm down to 64, which is the lowest that has been in a long time. If I go and do silly things like, I go to Italy and drink wine and have a bit of gluten here and there, and go to sleep significantly later, my antibodies will shoot up again. So it's like a constant, sense of balance that I need to find in my life in order to keep Hashimoto's at bay. Okay, so is it good to ask for thyroid ultrasound? Yes, it is. That's a really good question. That's very helpful. One of the things the doctor should be also checking, with a lot of doctors don't, is having a total inspection of the thyroid. You should be able to move your head to the back, swallow, move your throat. As you move your throat, your thyroid will be moving it with you. And so this is like one of the very simple tests that your doctor should be doing. Doing an ultrasound is a really great idea, especially if you've had thyroid nodules. And so, is there arthritis pain with Hashimoto's? I wouldn't say that's directly connected, but Hashimoto's can cause a lot of body pains and aches. That's one of the symptoms. But, body pains and aches can be also caused by a lot of other things. But a lot of people feel that when they address Hashimoto's with a really good diet, they have they significantly feel a lot less pain. So I want to invite you to the workshop that Dr. Alan Hopkins and I are running on Thursday. I hope you join us. We're going to be talking about not just thyroid, but also estrogen, about progesterone testing, doing Dutch test, and how to order it, what to look for, how to interpret the markers. And so I hope this is going to be helpful. And we're going to be passing on the $20 discount on every single panel over to you. So you can benefit from that as well. If you have a doctor who can collaborate with you and order that for you, just do that. It's just so much easier that way, right? Well, I hope this is helpful. And like I said at the beginning of the video, if you are having a lot of these symptoms, please don't ignore them. Please don't tell yourself this is your age. In fact, one of the things that I said when I turned 50 was that if you're finding yourself saying, oh, I'm getting, I've got pains and aches and I'm so tired because I'm old, and you're only like 50 years old, 52, 55, even 60 years old, even 65, and you're aching everywhere and you're exhausted and your hair is falling out, that this is not about getting old. This is just about you not paying attention to a lot of things that need to be addressed, that can be addressed. And once you do, you're going to feel like you are in your 30s again. Thanks everyone for being here today. I hope to see some of you on the workshop on Thursday, and I'll talk to you soon. Bye for now.